So there's a couple different products that I recommend, and it depends on the type of dry eye you have. I used to be one of those doctors that would just prescribe artificial tears, and that's all I really did, until I learned more about the different types of dry eye and a better approach to treating it more systematically rather than just throwing the kitchen sink at it. With aqueous deficient dry eye, again, that's when we don't produce enough tears. That's typically when we will prescribe a prescription eye drop like Restasis or Xiidra. Those are the two common ones. And that I'm not a huge prescriber for medications. I like to take a more natural approach. But with the aqueous deficient dry eye, that helps to reduce inflammation. Those drops help to reduce inflammation, which can be really beneficial for people with that condition. And then there is evaporative dry eye, and there's different approaches to that, but I can go over some of the products that I usually recommend. So again, with the evaporative dry eye, which is the more common type of dry eye, at least 85% of people with dry eye usually have that type of dry eye. It's related with a problem with the oil glands called the meibomian glands, and that's when the meibomian glands get clogged up and they're not producing the oils like they should be. So that's why if you have that type of dry eye, it's really important to keep the lid margins nice and clean. And I'll go over some of the common products that I recommend for cleaning the lids, because you can see in this mason jar, you see that frothiness. I talked about that in the last video. That frothiness sometimes comes from the bacteria producing the enzymes, and that interacts with the oils in our eye on the tear film. So you want to make sure to clean the lids real well. One of the products that I really like that I use on a regular basis is called Pure and Clean, and this is a hypochlorous acid spray. There are different brands out there, but this is the one that we carry in the office. So hypochlorous acid is what's actually found in white blood cells that help the body fight and kill the bugs. So it can be used to help fight bacteria, viruses, and so this is just a spray that you can spray on a cotton ball and then just wipe your lids with it. There's another product that I like called OcuSoft, and this one I'll usually use in the evening time because it can be used as a makeup remover, but then it also cleans the excess oils and helps prevent bacteria buildup. So they are these individual wipes, and you just open up the package. I'll actually show you. So when you open up, it's like a little wet wipe like that, and it's actually got a texture to it. So I will usually wrap it around my finger and I'll scrub top and bottom, or I'll scrub one eye, and then I'll flip it to the other side to clean the other lid. And again, that can remove makeup, but it's really good for cleaning the lids on a regular basis, especially if you tend to have crusting or discharge when you wake up in the morning. So with evaporative dry eye, it's really, really important to have some type of good lid cleanser so you prevent the oil buildup, which can eventually clog the oil glands. And usually when you have that type of dry eye too, I recommend a lipid-based eye drop, so something that will help to restore that oil layer. And there are a lot of different types of drops, but that's something that I'll have my patients start doing, is choosing an artificial tear that is lipid-based. This is another product that we prescribe for dry eye, and this is a fish oil supplement. I prefer this one. This one's called from a company called PRN, and this is their DE3. So these are basically physician grade fish oil. They come in these capsules like this, and you take 3 a day, which is why it's called DE3. This one has 2,400 milligrams of the omega-3, and the importance of the fish oil is that dry eye is usually an inflammation of the eye, and the omega-3 helps to it's an anti-inflammatory, so it has that benefit working from within, and it also has other benefits like if you have dry skin, if you have inflammation of the joints, sometimes that's beneficial, but this one is made specifically for dry eye. So just wanted to mention a few products. There's obviously a lot of other treatments that we do as well, but those are some of the common over-the-counter ones that I like. When somebody has a more severe issue with the meibomian glands where the oils get clogged up, we do a treatment in office called the Eye Express, where we'll actually squeeze out the clogged oil glands, and that's something that we could talk about if somebody were to have the need for that. So if you are using artificial tears on a regular basis and you're not noticing improvement, definitely consider scheduling a dry eye evaluation. There is more dry eye information on our website, which is www.eyecarenorth.com, or you can also call the office. The office phone number is 480-361-7040.